So I have to be honest, I was doing Mama Bear for multiple years before I was able to answer this question. And when I came upon the 5 protective factors, it was just like a eureka moment, because I had felt that some of these were the answer to it, but I had never seen it in a concrete, organized plan. So I was so excited to come across this, because the reality is, and first of all, I want to say, this is not exhaustive. This is not the one and all fits, one size fits all answer to preventing child abuse. This is more geared towards supporting families where the parents want to be good parents, but they struggle with stress, they struggle with their own trauma and emotional health issues, they struggle with understanding child development. So this is not the answer to all child abuse, but this is a big part of it. And this is how we as a community and as people, in our own neighborhoods and friendships can help other people become better parents, and even ourselves. So I'm going to start up here at the top. Knowledge of parenting and child development. When we as adults understand the whole process of how a child's brain develops from infancy to through the teenage years, it's like it's not such a struggle anymore. We're not fighting them. We understand what they're going through, and therefore we can respond appropriately. Resilience. Parents that feel like they can make it through challenges are more likely to remain positive through them. And that's something that we as adults can help inspire in other parents, encouraging them, being a source of support for them. It's like if someone needs someone to watch their kids so they can go to a doctor's appointment. If you're a caring adult, you can do that. And if people don't have social connections, it can make it really challenging. Isolation is a huge issue in terms of child abuse. Concrete support in times of need, meaning families that are struggling financially, they can't find a home, they can't find a job, they are struggling with health issues. When the community helps provide those resources that families need, they can focus more on their children rather than being overwhelmed by stress. And lastly, social and emotional competence of children. When children have emotional issues and they're struggling, it can make the family dynamic that much more stressful. So when, schools get involved or pediatricians get involved and children get the therapies and, the guidance they need, they can actually also influence their relationship with the family and make it easier for parents to communicate and respond to those child's needs. So it's really, if you want to know the answer is love. The answer is we have to care, and we have to do the work of learning, advocating, and taking action.